So I'll just start now because I really wanted to make this a narrative, like a storytelling time. And I feel like, oh God, I guess is this like the fifth time? Maybe the fourth time.
Sure.
But it's done what I had hoped, where as we've gotten together, I think we've all started talking about it. We've started to, we brought in scientific language, and I think we're all going to our own lives, and then even within the church or whatever, just sort of as emissaries talking to each other. And now it's much more storytelling and how we're going to come together as community and the decisions we're going to make that are consistent with, what we are at Church in Ocean Park. And I just want to continue that. And decisions are going to need to be made. And this whole story is going to continue even after we get through this whatever phase we're in, because now what we've learned, all of this stuff is going to be used for the flu shot, for treating other types of diseases and everything, and it's not done. And we're at a place now that I remember with HIV, and we're all very much players in this whole drama. And so I want to bring it together that way. And I was very impacted by HIV, and I'm even going to weave that in because I went to medical school in 1979, and I went to medical school in downtown Detroit. I lived at 8 Mile, where they made the movie, and I chose to go to Wayne State, which is in Motown, and I could have gone to University of Michigan, which is in Ann Arbor, and then this very odd syndrome started showing up, where people, largely gay men, were starting to get immunodeficiency or infections that came from immunodeficiency. Nobody knew what was causing it. And that was in 1981 when those cases started. So I did my residency from 83 to 86, and then 86 to 92 was my fellowship. I was in Ann Arbor, Detroit. You can't hear me.
No, you accidentally
muted someone else, and
okay.
muted you by accident.
All right. So I bet this traces all your lives too. And we are now in the same place. We've had a year of this, and it traces, we're starting to experience it in the same way. And interestingly, many of the same players in the science are involved. So I just want to tell you a few stories about them, because you're going to see them. And I know the moral decisions they made and whether I thought they were moral or not. And so I think we can decide, we can watch them and see if they're going to make the same moral decisions as it comes, or social justice decisions as it comes about. So I'm going to start with, I'm going to show my age. Oh man, the head of the NIH right now. This is so funny. I'm blanking on his name. Well, anyway, you can kind of picture him. It'll come to me. He was he did a big fancy science fellowship. And when I was a resident in Ann Arbor, he came to, they recruited him to Ann Arbor to be an attending physician. But it was because he was involved in molecular genetics. And so he was my attending.
Is it Francis Collins?
Thank you. Francis Collins, you're good. Francis Collins very, very smart, terrible clinical attending, just terrible, terrible, terrible. And we could never get him to pay attention to the patients. He never gave us very good advice on patients, but we heard a whole bunch of stuff about molecular genetics. And he eventually left, but went to head the Genome Project and did a really good job of figuring out how to sequence genes. And now he's head of the NIH. Now, what's interesting about him is he's a white Christian evangelical, and he was converting just as he was in Ann Arbor. And he plays music, he plays guitar, and that is very much part of his personality to have this outlet. But it is very much white evangelical. And it comes out in how it informs what he does. He's very good at putting things together, though. Now, the person that preceded him was a man named Harold Varmus, who was at UCSF, University of California, San Francisco, when I was there. And he actually discovered HIV, the virus that causes AIDS. Now, he was brilliant. I adored this man. His wife was a journalist, and get this, she wrote for the Sacramento Bee, the newspaper, about the Bible. But she would have been a member of Church in Ocean Park and would have loved it. And Harold it was Harold, we called him Harold. And he was very much involved in social justice issues and did a lot to bring the NIH around. And he was under Clinton. He was really great. I guess he's not around as much, but just his approach is, what happens is going to be dependent on decisions that Francis Collins does under the NIH. And then there's a guy named David Kessler, and he was with the FDA, and he was he's now being used by Biden for procurement of the vaccine. And that's important because what David Kessler did is he made sure that American companies provided HIV treatment to other countries globally. And that's why HIV at appropriate cost. And that's what he's doing right now. And that's why the procurement for the United States has been so good, but he's looking for an eye to what we do globally. And he made some really good decisions. So I'm really glad that Biden has included him. And then, and David Kessler was a fellow when I was a fellow at UCSF. And then there's Anthony Fauci. And I have to tell you, I go back and forth because I know, in a way I go back and forth because I know he can play the politics of science politics. They're not easy. On the other hand, he made some pivotal decisions with HIV and treatment. And if he hadn't made those decisions, we would not be where we are. So his intellect is really sharp. I think he's made some good decisions with COVID. And so I think he's a good guy. And then Rochelle Walensky, I don't know her well. I know a bit of her. She's a mom. She has 3 children. She's been East Coast educated. People think very highly of her. She really brings a science to it. It's public health, which is different than the science of the NIH. And it's much more treating a population. And she much more makes the decisions in a way what she as a mom would want. And I've seen her I've seen her cry at presentations and wanting to bring a humanity to it. So I sort of trust her. And the cross currents are good. And then I want to start telling a story about the development of these vaccines. because in a way we take it as a given. And I think if we think about the story, we much more know what to do next as we deal with the, still the appearance of the variants, and then the group amongst us who has chosen not to go the vaccine route. So to start with, vaccines kind of have a history. It's interesting to think about. But what I want to go back to, and this is a little bit of a chart, and I guess you can see it, but Hurley Jim has been doing something with malaria for a very long time. And I started to realize, oh my goodness, that's doing exactly what we're doing with COVID right now. But Hurley Jim started doing this a long time ago. And I have, and like this impulse to get involved with something that affects the globe in a social justice way has been around for a long time. And Hurley Jim was doing it. And I realized, I think, and Hurley Jim, you can tell me if I'm wrong, in a way, environmental concerns drive sometimes what you're doing. And the use of DDT with malaria maybe is what got you involved. But needless to say, you got involved with something that is very similar to what we're doing now. And so my little chart, and what's the role of science in it versus behavior? And so I have my chart about, I put malaria first. What is it? Well, it's a blood-borne parasite. And it causes a disease that I think I've seen it, but not a lot. And then I put, the next one is, I put the virus first and then the disease second, and that becomes important. So the disease is AIDS. The virus that causes it is HIV. That's a blood-borne virus. And then COVID is actually the disease, a coronavirus disease. And the number 19 is the year it was discovered. The virus is COVID, or SARS-CoV-2. It's severe acute respiratory syndrome, and it's the second virus that has hit in a pandemic. And so virus and COVID is a disease. And so that it's blood. So what is the vector? I mean, what would be the way to block it? All of them have a way to block it that's low tech. And if you know the way it gets into the body, then you can think about how to block it. And it's like so simple. So COVID is a respiratory virus. How do you block it? Well, you do it by a mask. It's simple. Malaria, it turns out it uses the vector. It's a mosquito that would bite the blood. So what's the low tech way to block it? Well, it's a net so that the virus can't bite you. It's kind of simple. And then HIV, it's bloodborne, so you don't want to exchange secretory solutions. And it turns out it's a condom. And it really is no different than wearing a mask. And if we just start, whenever the next pandemic comes, you figure out the portal of entry. And that's how, in a cultural way, you very quickly get into a behavioral mode to protect yourself. And that's what Japan and South Korea and other countries did. If we had done that at the beginning, we could have, probably prevented 500,000 deaths. And next time this happens, we should do that. And we should also continue to do it as we have risk factors that turn up, and we should all fundraise for malaria. And then I have to laugh. Is there a drug that treats malaria? Well, it is. It's hydroxychloroquine. Boy, has that taken on some meaning in this little story. And I know hydroxychloroquine by the brand name of as Plaquenil, and it's a very toxic drug. And so when Trump was spouting off that we could use hydroxychloroquine, and I said, I had to figure out that it was Plaquenil, and it's like, well, I'm not throwing that at people unless they really need it. It's used for lupus, and I saw it in it's a type of lupus, discoid lupus, that affects the skin. It's a very toxic drug, so you only use it if you can. I mean, if you have to. And then, the viruses or the diseases that we have that actually have been able to have a vaccine are there's a lot of diseases that don't have vaccines. Malaria does not, HIV does not. And I think respiratory viruses, for one reason or another, are able to have vaccines developed. But in a way, we're lucky that this vaccine could be developed. And so, but then I want to talk a little bit about what vaccines we have. And in a way, you can look at the vaccine as the big science intervention. We have the mechanical protection, but you need the big science, or do you need the big science intervention, which sort of becomes a question. And that's a question at hand between, the unvaccinated and the vaccinated group. Are the unvaccinated people going to be willing to do the big science intervention? And we have to, in a way, develop a compelling reason to, maybe push it. The history of these vaccines is that, and I don't know that Trump really had anything to do with this, but that, that warp speed thing, whatever it's called, the idea was to use this whole idea about innovation to generate a better vaccine. We already had vaccines that were coming from other platforms. And there are, or platforms is the right way to think about it. And basically, there's three now. One, a vaccine develops immunity to some portion of the infecting organism that makes it so that it can't infect. And you get antibodies, which we all hear about. You can also get memory cells, which is a cellular response. And there were two basic platforms before they did this thing with innovation. The first platform was the purified protein of interest. And this, we're using spike protein because it's what on the virus, it binds to a cell in the body and gets in the cell. And if you can block that, it can't get in the cell. Well, one way to get an immune response to the spike protein is just to inject the spike protein. And there are vaccines that are going to be coming out with that. There's one called Novavax. It's not out yet, but some people think that's the simplest from like a theoretical point of view, and their mind can accept it more than these other ones. So there's that. And then there's what we've done is use a virus as the platform, where we take a basic virus that they've altered, that through molecular genetic means we can splice in whatever gene we want that virus to make. And in this case, it has been a spike protein. And that's basically what's out there. So if you look at the vaccine, that Sputnik, we hear about it. It's a virus, respiratory virus-based, it's a virus-based platform. If you look at what Cuba is developing, it is purified protein. And I have a chart that I'd like to send around. It tells you what platform they're using. And it's important to know because China developed one, a couple of them. They're terrible. They don't work. Russia developed theirs. It's the virus-based one. It works very well, but Russia does such a bad job distributing things globally that they're not getting much traction. England, with their AstraZeneca, it's a virus-based one, and J&J is virus-based, and it is what. So what happened that was unexpected is we did this warp speed thing where we said, with your innovation, go and make something. Well, they made this messenger RNA vaccine. The basic science for Pfizer was done in Germany. The basic science for Moderna was done here in the United States. We had no previous experience with these mRNA vaccines. The mRNA does not go to the gene. The RNA gets the nucleus where the genes are. It's out in the cytoplasm in the cell, and it makes the spike protein, and then that goes out and make the antibody. And apparently when they do, and people that are in business would know this, but when you want to spur innovation, you develop a set of outcomes that you want. Well, this was to be a highly effective vaccine. What they didn't include in the directions was to make it globally easy to distribute globally. So basically what we got though were these two vaccines that are mRNA. They're being made and distributed by US companies. And they were shockingly effective. Shockingly. So the viral vector that everyone else is using is about 70% effective. The Moderna and the Pfizer are 95 to 100% effective. It's a game changer. Nobody expected it. The problem is they made it so you're not able to distribute it very easily globally. If they had included that, they might have made a carrier that didn't require all this refrigeration and all this other stuff. But I guess when you're thinking about it, what happened with it is that is US-based technology. To get it global, you're going to need these people that are going to want to facilitate global distribution. And then we're going to have to figure out a way to make it easier to distribute. All right. So now, so what happened is we had this pandemic. It started out in China. There's a bunch of political discussions about how it started, but in a way it doesn't matter. It came to the United States. We should have put masks on right away, but Trump, from a vanity point of view, couldn't stand having a mask on, and he said it looked like either a jock strap or a training bra. And so that's why we're not doing it. And it's so silly. And then let's see. So, and now, and then we didn't do the behavioral things that if we had done, we would have been okay. Other countries did. So South Korea, Japan, China, they got it under control. Europe is sort of halfway in between. The thing though, but what Biden did is he decided to use these highly, highly effective vaccines as the mainstay of our therapy. So that's how we got our country under control. And no other country has access to this highly effective vaccine like we do. So they can't do the same thing until procurement is the same way. And are we going to be able to do that? And I guess where I want to take this and then, kind of open it up for discussion is that we would be India if Trump had become president. Because we wouldn't, India is actually doing better than us. They're willing to use masks. The only reason we're doing it as well as we're doing is because we have the vaccine. And we need to understand that, because we don't know how lucky we have it and where we would be if we didn't have the vaccine. And so, and then just to get to the issue of the vaccine. Oh, okay. There's a couple things I want to say. First of all, the disease is different than being infected by the virus. And all the studies were done on the disease. So you have mild, moderate, and severe. And so all the measurements of efficacy are based on how you express the disease. And it's only mild with with the vaccines, even with the Johnson & Johnson. However, when we're testing people, that's actually testing for the virus. And people that have been vaccinated, they're now showing up with the virus. Well, that wasn't in the studies as to whether or not you could be infected. So it's really not scary in a way that the virus can be transmitted. What it would be the problem is whether or not it can be cause disease. And in a vaccinated person, it's not going to cause disease. In an unvaccinated person, however, it's going to cause terrible disease. And it's going to be transmitted back and forth. And our whole mechanism of dealing with it is not behavioral, because we're not accepting it in this country. It's the vaccine. And so somehow we have to, I think this is the discussion, what do we do with the unvaccinated people? Because how do we deal, how is that community dealt with? And I want to bring up a few things. Some of the reasons that people don't want vaccines is they haven't trusted the institution of medicine. And it's for good reason. And different people have different reasons to not trust an institution, but they have shown that it really is associated with a PTSD-like syndrome. And that's how you approach it. Other people have issues around not wanting to have fetal cells used. Well, that's important to them, right to life. Well, there are certain of these vaccines that are known not to use fetal cells, so we could guide them that way. And and there are other issues that come up, but since our society has really decided to use vaccines as the way to treat, and it's not true that you won't get really, there's these various conspiracy theories that say you don't get sick if you get, especially if you're young. Well, that simply isn't true. And as we get these variants, it's selected to be more transmissible. The idea is not to kill the patient. The virus really doesn't want to kill us, because it wants to have a place to reproduce, but it really wants to become transmissible. And the Delta variant has more than one mutation in it, and that's why it's becoming more and more transmissible. And some people have said it's so bad that it shouldn't be called COVID-19, that it should be called COVID-21, because it's so much worse. So anyway, that's where I am with the variant. And it is breaking through into vaccinated people in terms of causing infection, but not in terms of causing disease yet. So I guess that's kind of where I wanted to take this. We really are in a situation where, as a community, how do we get together? what those that have chosen to get vaccinated, it's a choice. Those that have chosen not to had their reasons, but it feels like it's a risk. And it's going to be really, and then one easy thing to think about is wearing a mask can be thought of as equivalent to getting vaccinated. The data really shows that. And being inside really is the only unsafe place to be. Being outside is without a mask is probably very safe. So that's sort of my narrative. I'd love to hear, I really would love to hear what you guys are thinking. Daria.
I have a question. You said that both HIV and malaria do not have a vaccine, and those two diseases, if you will, are affecting primarily Africa, I think, and probably.
Well, HIV didn't just affect Africa. It did affect it though.
My question is there like a systemically racist kind of reasoning behind the fact that those two things that affect Africa more so do not have a vaccine? Is there a social justice component here?
No, nobody really understands. The scientists do not understand why we couldn't develop a vaccine against HIV. We don't understand it, and we just can't. So we switched to, and this is where Anthony Fauci came in. Since we couldn't get a vaccine and we couldn't get other sort of basic treatments, he did this brilliant thing. Okay, the reason so many drugs, tuberculosis is another disease that we don't have a vaccine for. And the farther away from a human cell that an organism is, the easier it is to make a drug that blocks it, because you're not making a drug that would also affect the human being. So that's why hydroxychloroquine is so toxic. Is malaria is a parasite. It's closer to the human body. And so the drugs to treat malaria are, and the reason we were able to get HIV drugs is it is an RNA virus in that its double helix, its genome is RNA. It has to be made into DNA to replicate. We don't do that in the human. So you could develop things that block that pathway without hurting a human being. And that's what they did. That's what they do now. They're the antiretrovirals, reverse transcriptase. We went that direction. So we can't vaccinate, but we can give that drug forever. As long as it brings down the levels, then we're safe. But it means you have to take a drug for the rest of your life. And so there are white supremacy did come into HIV, and I saw it, and it's a little odd in that it was white gay men that got it, and it was denied to Black men who were thought to be IV drug users. So historically, some really unfortunate things happened. So there are social justice things to think about. The fact that we don't have vaccines isn't one of that affected isn't one of them. Yeah, Jean.
I heard something on the radio this morning about Thailand has been really affected because so much of its income is through tourism. And there's one island, I think it's called Phuket, something like that. And so now there's all this controversy about it because they're also having a surge of infections. And so people might not want to be going there, for this vacation. And the vaccine that was used there, I think, was developed in China.
And it's a bad one.
Yeah, and that's what they're saying. So what is it about it? It's just not fighting the virus at all, or
Okay, I have this chart that I'll send around that has what's in it. And they've done a few, but they have these inactivated monkey cells that they somehow infected with the virus, and they're not working. It's like a bad concept, and China's didn't work. And now what has happened, and it's like what's playing itself out with the Olympics. Japan was able to do the behavioral mitigation preventive behaviors with mask wearing and then appropriate contact tracing and all that. So they kept it at a very low level. But they're an unvaccinated population. So they lived, but they're like sitting ducks with a whole bunch of people who are uninfected. They have no immunity in the population. So now what do?
why are so many Japanese unvaccinated?
Well, that's what they're asking their government. And they made so this is why I wanted to talk about the development of mRNA. Only we have that technology in the US. A little bit Germany does because they have the company that did it. Other countries very quickly put into place those mechanical barriers and the behavioral things, but then you're left with a population that's unvaccinated. We're the only country in the whole world vaccinated. And we would be India if we weren't vaccinated. And so, and Daria and I were talking about this the other night. Well, why don't we just get the vaccine to people? You can only make it so quickly. It is only stable. So, certain ones are it's really the virus platforms that are stable, but they're not as effective. The mRNAs, they're just ramping up. This David Kessler, who's the procurement guy, he's, you could only get it so fast. How do you get it to them refrigerated? We can do all that, but it's just not going to go fast. Mm. So, and we're, all of us that are vaccinated, we can just, wander around. Anyone that's not vaccinated is a sitting duck, especially for the Delta virus. The Delta variant. Mm. Go ahead.
So continuing with that, are we who are vaccinated needing to go back to, like, in stores in California right now, at least in Los Angeles, we still are wearing masks. So am I needing to double mask because of the Delta variant, or has it been shown that the Moderna and the Pfizer are good against the Delta?
What they've shown is this is the difference between disease and infection. And the other country that's highly vaccinated is Israel.
Right.
And a certain number of infections with Delta came up. No, only like 10 had severe disease. All of it has been mild. So I actually think outside, no one has to worry about a mask. I think inside, somebody who's vaccinated is probably okay, but there is nothing wrong with wearing a mask. You're certainly not, you're going to protect yourself 100%. If you're with another vaccinated person, I think I may not wear masks, but we're going to practice getting together. You're never going to hurt yourself by wearing a mask. And if there's breakthrough, which eventually we're going to get a variant that is so bad that it's going to cause disease in a vaccinated person, the mask would prevent it. So, I think we can do common sense. But inside is the only place you have to worry. I don't know about double masking. I think you just mask.
Well, right now, restaurants are opening up inside.
Yeah.
In fact, they're taking away their patios, the tents that they rented and all that. And the other day, I don't remember what happened, but we actually went inside a restaurant and it was I did it against my better judgment because I'm still nervous about it. And I don't even think they were seating us 6 feet apart. So, what are the newest guidelines in LA County?
They just changed them yesterday. And they had taken them away. And we are going to see a surge in the unvaccinated group. Now, in LA, we're lucky because our overall community has a fairly high rate of vaccination. So the group that it can replicate in isn't all that large. But the red states, they're under 50%. They're just sitting ducks, and they're going to generate the stuff that and then it's going to travel across state lines. And so, I think, Jean, I think it's okay to go inside if you're vaccinated. I really do. But I think it's worth wearing a mask, but not big time mask, just a mask. Yeah, Carol.
Had a recent experience. I'm Moderna vaccinated in March, and I got a fever on Friday. And so I still had the fever on Sunday. So I asked to have a COVID test, which isn't nice, by the way. And it turned out to be an upper respiratory infection, which is really a good thing. But that's what's going to happen. The minute I started taking off my mask, I got something.
Mm-hmm.
Yeah. So Daria pointed out that there's hands, and I really apologize. My son Kyle got a mask because he was traveling in Japan, and they just plain wear masks in high density places so they don't get the flu and that kind of thing. And I have a feel we should all do that, to some extent. I'm sorry, I don't know who. Oh, got it. Okay. So I see Donia and Abby.
Abby
So
was first.
Okay, Donia, you thought you were first? Abby?
Abby was
Okay.
first.
Okay.
Okay, Abby.
There was something that this may have been already addressed. I don't know. There was something that came up on the church survey about separating people who've been vaccinated from those who haven't. We'd be in the same place, but different positions in it, like one side of a room and the other. Is there any public health reason for doing that?
Abby, I'm glad you brought this up because this is the thing I feel really, really strong about. I feel strongly about it. And it's interesting. Trump made he lied about this, so it must be important. And basically, it gets transmitted by small dispersed droplets that go into your ventilation system and get circulated, rather than large droplets that fall to the ground and are dependent on social distancing. So in a way, the social distancing isn't as important as a mask and ventilation. So having a group that sits far away in another place or another section of our sanctuary, for instance, doesn't make all of us safe. It's literally dispersed all over. It's circulated by whatever ventilation system you do or do not have. And social distancing to like a different section, it is a false there is no section they can go to that is far enough away. It just plain needs to be outside or a mask. There's really no other choice. And we could do it where if it's only the unvaccinated people that really need to wear a mask, but that would be identifying yourself as unvaccinated. Yeah. And that becomes the issue. Does that answer your question, Abby?
Yes.
Donia, what's your question?
I've got a bunch of them.
Good.
I'll start with, I've got friends who have not gotten vaccinated. They say enough research hasn't been done on it, on the Pfizer and the Moderna. And what would you say that I say to them? And in one particular case, her family's all African-American, and because she's the matriarch and not doing it, half of her family hasn't gotten them.
The how you talk about it is really the next chapter in the story. So I really want us to be able to talk about it like we are, so that we don't become divided as a community, and we're using concepts that we can all agree on the facts. And so now what they're talking about is, what is the risk if you don't do something? What's the risk of action? In other words, doing the vaccine versus the risk of not doing the vaccine. So we know if you get COVID, and especially one of the variants, you can get very sick. We know with the vaccine, a certain number of people get sick. And what's going to be interesting to people like me who are interested in the science is the side effects of the vaccine are related to the side effects you get with the virus. So, it binds to a cell that's in the vascular. It's in the endothelium on the vasculature. That's why the complications are a myocarditis, inflammation of the heart, which is related to the vasculature. That's why there's thrombosis in the brain of women. That's why there's strokes in young men, because it's all related to the vascular system. It's 1,000 times worse if you get the disease than if you take the vaccine. So I'm not denying that things happen with the vaccine. I'm just saying that they happen so much worse with the disease.
Now I'll ask my personal question, if that's okay.
Yeah, please.
So I, because of the New York Times article saying that people who are on immunosuppressants because of transplants,
yes,
or people who've had chemotherapy may not be getting as much, producing as many antigens from the vaccine. I had the spike protein test.
So, honestly, I thought of you, couldn't help but to. And it'd be interesting as to whether you can ask your transplant physician about it. What they're finding with these mRNA vaccines is you need a third one.
Right.
And that the immunity is and so Anthony Fauci with us, the United States, made the decision that we were going to get 2 doses of the mRNA vaccines, rather than what England made the decision to not give 2 doses and spread it around. Well, it is only a third effective with disease with 1 dose. It's 90% effective with 2 doses. And in somebody that's immunosuppressed, you probably need 3 doses just to keep ramping it up. So if I were you, I would try to find out how I could get a 3rd dose.
Yeah. And what I heard, I go to a Walmart pharmacy, which I never wanted to do, but it turns out they're really good. It's because of Medicare. But anyway, they're really good. And she did research, and she said that what she found out is that we're going to be able to, we're going to be able to take the 3rd Pfizer, whether or not you had Moderna or Pfizer. So that's really good news.
And Donia, I heard that there are trials that kidney transplant patients can get entered in right now. And your transplant doctor may know of and I would get in a study right away as well.
Yeah, she does not, but I will call UCLA. I mean, I'll call Cedars-Sinai, where I had my transplant, because I think they're more knowledgeable. You don't have any idea about the spike protein number.
Well, and it's really confusing. There is the cellular immunity, T-cell immunity, and then there's the antibody producing cells.
Mhm.
We do not know if the level of antibody tells you anything about level of immunity.
Yeah.
And I heard a really good talk on, and I don't remember it all, but about how they measured immunity in transplant patients. You know how they're measuring it is by this whether or not people get disease and whether there's an uptick in disease. We don't have any laboratory tests that really tell you the amount of immunity.
Yeah, I didn't think so. Would it make sense to have it? Can you get a T cell test?
They're doing these in vitro tests.
Uh-huh.
Nobody knows what they mean.
Yeah,
And
exactly.
Pfizer is, you got to be a little bit careful. They have something to promote. And they're kind of clever from a monetary point of view. And they're the ones saying that you need a booster. And Fauci is saying, no, you don't. But honestly, if I had a transplant, I would want that third dose. I'd try to find out how to get a third dose.
Good. Thank you very much.
So I guess I want to think about, I'd like you guys to, I want to think about how we should discuss those who have decided not to get vaccinated amongst our church members. Because honestly, it generates me a little bit of like, God, just do it. But then, I guess people have their reasons, and I'm willing to go down a bit of a pathway to try to understand why one person doesn't want it versus another. I think what Abby said, no, you can't be in a different section. It's just not a thing. Are they there? Since it's a small group, is their interest in choice selfish? There are studies, or there's different discussions now made about how different societies work together or not, whose choice is more important than another person's choice. I mean, how are you guys thinking about it?
From certain theories that I've heard of people I know who are choosing not to get the vaccine, I've heard that there's a fear that too much of this vaccine has been pre-planned and that there's this really nefarious, terrible agenda to kill off society via vaccine, and that it's not like they're saying, oh, screw you. What I've heard is there's a fear of the systemic agenda planning, kind of like big governments planning to do all sorts of crazy things through a vaccine.
So, and how do we handle that? I really want to, when I discuss things with people, I don't want to be working off of conspiracy theories. And I don't mind talking about someone's genuine concern, but I don't want to do it from something that clearly can't be happening. And so, for instance, with the mRNA ones, they get packaged in this lipid thing as a way to get it into the cell. So it's made itself a conspiracy theory predictor in that people think you can mix all sorts of things with it. It isn't happening. Have you guys seen the thing with the key sticking to the woman's face, where they're saying the vaccine is magnetizing people? Well, the funny thing is, people with teeth problems, like my face is magnetized. Literally a key will stick to me. And so the person probably has a tooth problem, but the vaccine isn't responsible for it. But so when the people that don't want to be vaccinated in the church if they start talking conspiracy theories, I want to be able, I don't want us to have to talk from that position. But if they have genuine concerns, I'm sort of okay. Do you guys have any ideas about that one?
I guess my idea would be that the people who believe in the conspiracy theories, that is what they believe. And I don't think you can tell them, well, that's just nonsense, because at least I don't think I could convince anybody that believes that, oh, I don't know, Bill Gates is injecting, what do they call it?
Yeah, I know.
Electric things into you and they're gonna trace you, that kind of thing.
Yeah.
I can believe that some people really believe those theories.
So what I have heard people say is exactly what you said, Abby. And the way to deal with it is to, in a way, cause friction, in that make it harder to do things, but not try to disabuse somebody of a conspiracy theory. So that leads me to a question. If we're going to have gatherings, like social gatherings, like if I have something at my house, do I stipulate that I'm only wanting people over who have been vaccinated? What do you do?
It's so tough.
Carol, what's your opinion?
No, I'm thinking about, let's avoid prejudice altogether and everybody wears a mask.
Yeah.
Ta-da!
Well, and the easy thing is you don't have to do it outside and you have to do it inside. That's the conclusion I came to. Yeah, don't you have something to say?
Yeah, back to
It's okay.
personally again, and that is, should I be treating myself as if I'm unvaccinated?
Yeah, probably. I mean, you're probably better than that, but yeah, probably.
Okay. So should avoid inside places and yeah.
Gina, did I see your hand flicker?
Well, and maybe if I
Oh.
just real fast, the other thing
Please.
is in the African American community, are we finding that people in our church are saying that they don't want to be vaccinated because of past history or because of fears? Are you
You know
running
what?
into any of that?
Here's the interesting thing. They've done studies of the African American community. Do you know their vaccination rate is the same as white people's? So we're even making assumptions that are true. And I fell into that. Isn't that interesting? So basically, there's not too much discrepancy. And what's there, and in fact, it's the white male population that is not getting vaccinated that's driving our numbers down, and not the African American population. So there you have it.
Well, I think it was true about the African American population at the beginning. There was some lag time when there was a lot of talk about the way that African Americans have been treated by the medical community, et cetera, over history. But I think over time.
Yeah, when we addressed it and weren't jerks about it, it went fine.
Yeah.
And gave access and just sat down and talked to somebody in a reasonable way.
Right.
It's really us.
I don't know what to do about it, and I'm gonna have to leave actually.
All right.
But,
well,
no.
And your host,
I
right?
just wanted to say one last thing is
Sure.
that I think that especially in the church we have to respect what people say, and I think what Carol said is what we've got to do is just everybody has to wear a mask. I think that we can't even ask. Well, there are some churches that are requiring proof of vaccination to go in person. And I was not for that at first, but then I heard that there were other organizations. In fact, there was something that I applied for. I can't even remember what it was this week. It was a conference, and yeah, you have to show your vaccination card.
So I think that what Carol and Jane, what you're saying is the right thing. I guess what I'm still not clear about is if I say, for instance, like I want to you consider having, well, I probably have my answer, but a July 4th thing for the church, just to come over and do. And make it a fundraiser for fancy dress swim, whatever that's called. Anyway, do I at all stipulate, be vaccinated? I think probably not.
Yeah.
The-
Yeah, that
the
if we
the
start that
church-
exclusionary stuff, that's, the church is completely against excluding people for any reason. And if we
pop
start
for
that
the-
now, it's like, two-faced. But the other thing that I worry about is that unvaccinated people will not want to disclose their status.
Oh,
And
let's be private. I'll pop for the masks. I'm buying.
Yeah, I'm with you, but I'm glad we can talk about it this way.
yeah.
And we're the story. What the decisions we make, we're going to be Church in Ocean Park, and they're going to say this community went through it this way, and and we are, and I think we're going to have a certain amount of success, and we're going to know why we're making the choices.
Thank you, Claudia. This is terrific as usual.
This has been
Well,
really good.
Thank you, guys.
Thank you, thank you.
Thank you.
All right.
We'll
Bye,
look
Jean.
forward to what you're sending.
All right. Bye-bye.
All right.
Bye.
Bye-bye.